Hi, welcome to today's episode of my Career Q&A series. If you're just joining me, my name is Tina Ekayeme. I am an oncology clinical trial manager, a career mentor. I am also an immigrant who successfully built a career in corporate America. In this series, I answer real career questions and share practical strategies to help immigrants confidently to navigate the US job market. Now, let's answer today's question. Today's question is all about how to get your first clinical research job with no experience. The first thing I would like to do is to change your mindset, first of all. Understand that most people don't actually have no experience. They have no clinical research experience. And those are two different things. If you've worked in healthcare, for example, as a nurse, medical assistant, medical laboratory scientist, a physician, a respiratory therapist, or even in healthcare administration, any area of healthcare at all, you already have transferable skills. The key is learning how to present those skills like patient care, medical documentation, specimen handling, communication, documentation, regulatory compliance, name it. Right? These are valuable skills in clinical research. Secondly, another thing you will want to do is to stop applying for jobs with a generic resume. I've said it multiple times in my previous episode. You just need to tailor your resume to the role you're applying for. Let me tell you this, recruiters are not looking for someone who has done everything. What they are looking for is someone who has the skill to learn and succeed. You have to be teachable. It's just beyond you saying it. Thirdly, don't aim too high for your first role. Get your foot in the door. Let me tell you, many successful professionals started as a clinical research coordinator, clinical research assistant. I think in my previous episode, I mentioned how I started my career. I started as a clinical research coordinator, and then I grew from the site level, and then I grew to being a CTM at the sponsor level. Okay. Finally, network. Some of the best opportunities in clinical research never even make it to the job boards. You need to connect with recruiters, connect with hiring managers, connect with experienced professionals on LinkedIn, join clinical research communities. We have SOCRA, we have ACROP, we have Black Women in Clinical Research. Attend webinars and conferences. Engage yourself in conversations that will change your career. Remember this, every expert in clinical research was once a beginner. The difference is that they took the first step. Don't let no experience issue stop you from applying. What you want to do is you want to focus on your transferable skills. You want to position yourself strategically, and you want to keep learning. Bring yourself down to learn. Be teachable. The secret in this industry is you just need to be teachable. Now I want to hear from you. What is stopping you from breaking into clinical research? Tell me in the comments, and your question might be featured in my next Career Q&A episode. Don't forget to follow me for practical career advice to help you thrive, not just survive in corporate America. Until next time.